Today, we're talking about ALS, a diagnosis that truly tests the limits of the human body. But we're going beyond the physical battle. We're going to look at the one that happens inside the mind, where things like resilience and hope become absolute lifelines.
Think about that for a second. What does happen? This is the reality, the core conflict for thousands of people living with ALS. It's a journey where your spirit has to stay strong, even as the physical control we all take for granted starts to fade away.
And that's exactly what we're digging into here. This isn't just about what happens to the body. It's about the incredible psychological journey that patients and, their families too, have to go on from the very first day they get that diagnosis. All right, so let's get into it. The second a person hears the words, "You have ALS," it's like an invisible clock starts ticking. And right alongside that physical prognosis comes this immediate, just immense emotional weight. It's a burden you can't see. 50%. That's a huge number. For half the people diagnosed, the fight isn't just with their muscles, it's with real clinical depression or anxiety. We're not just talking about sadness here. This is a major mental health challenge right on top of an already devastating physical one. And the impact doesn't stop with mood. The mind itself can be affected. In up to half of all cases, people with ALS start to see cognitive changes. It might be trouble with planning your day or making a decision, things we do without a second thought. It just adds another layer of difficulty to an already impossible situation. And that brings us to a really important idea called anticipatory grief. See, most of us think of grief as something that happens after a loss. But for people with ALS, they're grieving losses as they're happening, and sometimes even before they happen. It's this constant process of mourning the ability to walk, then to speak, then to be independent, all while you're still living your life. Now, here's something that can get really confusing, but is so important to understand. On the left, you've got something called pseudobulbar affect, or PBA. It's a neurological thing that causes uncontrollable laughing or crying that might have nothing to do with how the person actually feels inside. On the right, you have depression. Telling these two apart is absolutely vital, because treating a neurological symptom is a completely different ballgame than treating a mood disorder. So, with this incredibly intense psychological landscape, who steps in to help? Well, that's where a very different kind of team comes into play, and they are a critical part of the whole care network. And this team is really a force. You've got clinical psychologists, psychotherapists, counselors, and social workers. But they're not working off on their own. They're built right into specialized ALS clinics, working together to create this sort of blanket of support for patients and their families. And here's the key. Their whole approach isn't about waiting for a crisis to happen. It's proactive. From day one of the diagnosis, they are there. They help manage that initial shock, navigate the challenges along the way, and help prepare for the future. They're partners for the entire journey. This quote really just nails it. For someone who's facing ALS, this kind of support, it isn't just about a therapy session here and there. It is quite literally a lifeline that anchors them and their emotional well-being in the sea of uncertainty and loss. Okay, so what does this support actually look like in practice? What's in the toolkit? Let's take a look at a few of the real evidence-based strategies these professionals use to help patients build up their resilience. Let's break it down. First up, you've got cognitive behavioral therapy, or CBT, which helps patients get a handle on those overwhelming, catastrophic thoughts. Then there's something called ACT, which is less about fighting the disease and more about accepting what you can't change so you can focus on living a life that's full of purpose. And finally, there's dignity therapy, a really powerful tool that helps patients create a lasting legacy by recording their life story for their family. And these therapies, they're not just some one-size-fits-all solution. They're specifically adapted for the realities of ALS. You have specialized programs like Me Balm, for instance, which are tailored to the unique burdens of the disease. They even bring caregivers into the process and are designed to work with assistive communication devices as speech gets tougher. Now, something that's so important to remember is that ALS doesn't just impact one person. There's a reason it's often called a family disease, and that means the mental health support system absolutely has to include the caregivers who are right there on the front lines. This chart tells such a powerful story. Look at this. While the distress levels for patients are obviously significant, study after study shows that the distress for caregivers can be even higher. They're dealing with their own grief, total exhaustion, and the unbelievable stress of watching someone they love decline. So the support for caregivers has to be just as strong. And it is. We're talking about everything from formal assessments to keep an eye on their stress levels, to counseling to help them process everything and avoid burnout. It also gets into really practical stuff like planning for respite care to give them a break, and even programs that treat the patient and caregiver as a team to make them both more resilient together. As the disease progresses, the focus of all this mental health support, it naturally shifts. And this brings us to the really crucial area of palliative psychology, which is all about maximizing quality of life, dignity, and comfort. You can really see how the support evolves right alongside the patient's journey. It kicks off with education and coping skills. Then it moves to helping a person adapt to all the changes while holding on to who they are. In the later stages, the focus becomes more about legacy and quality of life. And finally, it's about providing a dignified end-of-life experience while also supporting the family through their own bereavement. And this leads to what might be the most profound idea in all of this. Even when you're facing unimaginable loss, this quote reminds us that there is still room for growth. Finding new meaning, making relationships stronger, defining your own legacy. These are all types of deep, real psychological growth. And that brings us right back to where we started, with a question about the human spirit. ALS might shorten the length of a life, but the work of these incredible mental health professionals helps make sure that its meaning, its richness, and its impact can keep on growing right to the very end. Thank you for joining me.